always tend to do. All right, now it should be recording. Okay, so we'd like to thank you for attending this education workshop today. If you are interested in watching any of our previous workshops, please visit our YouTube channel. If you have any questions or would like to connect with us directly, you can send us an email at admin@karmasue.org. Today, we will have a Q&A section at the end of this workshop. However, if you have any questions as we go along, please enter them into the chat box or take yourself off mute, raise your hand, whatever you'd like to do. Emily, our facilitator, would be happy to make this workshop as interactive as possible. Today's workshop is titled Pet First Aid, The Basics. Our special guest facilitator is Emily Davenport. Emily Davenport, CWR, has been a veterinary professional for close to 2 decades, serving in multiple small animal and exotic practices. She is a licensed wildlife rehabilitator with the state of Colorado and the United States Fish and Wildlife Service. She is also internationally certified in wildlife rehabilitation by the International Wildlife Rehabilitation Council, making her only one of 4 in the state of Colorado with this designation. We will let Emily speak a little more about herself and experience in just a moment. Thank you again for attending our workshop today. As we conclude, we will send a brief evaluation via the chat box. If you can, please complete it as it helps us to ensure that KarmaSue continues to provide education topics that you want to learn about. Emily, I'll hand things over to you now.
Sounds good. Thanks, everybody. Thanks for joining us on this Saturday morning, depending on where you guys are in the state or country. I'm going to go ahead and share my screen really quick. Hopefully here. Let's see. Let's see here. We'll share and then we will go ahead and get started here. Here we go. All right. Hopefully everybody can see this okay. You guys can give me the thumbs up if you can see it. All right, cool. Well, welcome you guys. So this is our first pet first aid training. This is a presentation I used to give back in the day. So you can see a lot of my credentials have to do with wildlife. So why the heck am I giving you guys a presentation on companion animals? Well, I was a veterinary technician for just about 18 years. And I also used to train dog trainers and pet care professionals in pet first aid and emergency response. So that's kind of what this presentation is for today. This is not a certification program. Think of this presentation today as the foundation for kind of helping your own pets at home. For the most part, we are going to focus on dogs and cats today. Those are the majority of the pets in the United States, and so that's where our focus is going to be today. You know, we understand that pets are really special to their owners. They're oftentimes a part of the family, and so we want to give you guys the tools and the basics to be able to help those guys in the event of an emergency. Really, the steps you take in the first few moments of an emergency can save a life, and so that's what we're going to kind of talk about today. We're going to talk about emergency preparedness, but it's really important that you note that everything we talk about today is not considered veterinary medicine, and I am not a doctor. Let me say that again, I am not a doctor. And so if you have questions on anything we discussed today, talk to your veterinarian about it, okay? The goals of this presentation are to teach you how to be prepared for an emergency that involves your pet. And the goal is to kind of alleviate suffering and prevent further harm from happening. We're going to teach you to be informed about potential emergency situations and also to know what's normal in a dog and cat so that you know what to observe if there's something wrong that is not normal. And we should never confuse pet first aid with pet care, or as I said before, veterinary care, because remember, I'm not a doctor, okay? So we're going to go through some of these slides just for time purposes today, but we're going to spend a lot of time today on how to create a emergency preparedness kit and a disaster preparedness kit. We're going to talk about how to make a plan and how to be informed, all right? So first things first, I want you guys to think about these questions. Do you guys have a first aid kit at home for your family or for yourself? Most of us do. Most of us have those human kits that include band-aids and random things that have probably expired a while ago. But it's really important that we have one for our pet as well. So we're going to talk a little bit about that. The other thing I really want to talk about is, do you have an emergency preparedness kit? Now, depending on where you are in the country, a disaster may look different. Here in Colorado, we often have to deal with forest fires, for example, and blizzards are two of the big ones that we have to deal with. And some involve staying put, like a blizzard, you want to hunker down, and others, like a fire, you may have to evacuate. And so we're going to talk about that today a little bit in more detail. Um, so I want to first talk about first aid kits. So you can have a first aid kit separate for the humans in the family and then separate for the pets in your family, but it's also okay to include it all in one. It's really important to have emergency telephone numbers for your pets as well. So a lot of people will put together those medical supplies or those basic things to have, but they don't put in those important numbers. So numbers should include like your veterinarian, your primary veterinarian that you take your pets to, but also the emergency veterinarians as well in the area. You might also want to go out of your home radius and include some phone numbers of some other pet hotels, pet boarding facilities, emergency vets that are a little further out on the outskirts of town in case you have to evacuate, pet stores and things like that, because in an emergency, you may not have cell service. Or you may not have Google, I should say, so you can't necessarily look up that information. So it's really nice to have everything jotted down just on a piece of paper that you then keep in that pet first aid kit, so you have for easy access. When you think of a pet first aid kit, the best thing to do is keep it in a nice sturdy box. A tackle box works great, but even kind of like a soft duffel bag that it can still be rigid on four sides is also helpful. You can go a little crazy and have one that's too big. I should show you mine. Mine gets a little crazy. So it's nice to be able to have one that is easy to grab and move if needed, throw it in the car if needed, but also have it on your person as well. Or you can just keep a smaller version in the car as well. So one in the vehicle, one at home. If you regularly take your pets to work with you, it's really important to have one at work as well. And keep, of course, those medical supplies away from children and pets, and make sure you look through those things regularly. That way you can look for expired items. Some of the things I like to keep in a pet first aid kit are, of course, basic bandage material that you can get from Walgreens or CVS. So things like gauze pads, sponges, non-stick pads, and then there's something called roll gauze. You can also have, in the veterinary world, it's called vet wrap, but I think in the human world, it's also called cling wrap. Ace bandages, that sort of thing are really nice to also include in your pet first aid kit. And then other things as well, like a flashlight, most people don't think about needing in a dark area. If you need to look in your pet's eyes or down their mouth, a flashlight is really helpful. Tweezers are really nice to have in case you have to pull something out of your pet, but also a pair of pliers in that pet first aid kit is really important. That way, if somebody has an accident with wire or fencing or just something that needs a little more oomph, it's nice to have some pliers in there. Of course, latex or nitrile or nylon gloves in there. That way you don't have to get all yucky and you can protect yourself with some PPE is really important. Basic scissors in there as well. And then we get into some of the more over-the-counter medical supplies that you guys can have as well. Iodine and alcohol is nice to have in there, hydrogen peroxide, but then other things like over-the-counter eye drops or eye ointment is nice to have. That's something like aqua tears where you can flush the eyes, or saline water so you can flush wounds and eyes and things like that is really nice to have. And then just some basic over-the-counter medication. I would recommend talking to your veterinarian about what types of over-the-counter medication they recommend having in a pet first aid kit. But those are the basics. And then depending on your pets and your pet's medical needs, make sure you have a supply of their own medication if they're on it. Different types of ice packs and heat type things are nice to have in the pet first aid kit as well. All of this information can be found online as well if needed. And of course, talk to your veterinarian about your particular pet and what things should also be included.
Emily, can we pause real quick?
Yes, of course.
There is a question that's from that slide. Erica asked, does iodine, hydrogen peroxide, alcohol have a shelf life? I actually don't know.
They do. So all of these liquids, all of these over-the-counter medications, and believe it or not, even the bandage material that you buy will all have a shelf life. So I make a good habit of really, if we were being very good pet owners, we would go through our pet first aid kit and our emergency preparedness kit twice a year. So every 6 months, and just make sure that those items aren't expiring. But once a year is usually what I do. And it's pretty amazing. I also have a small first aid kit for when I go hiking. And it includes items for me and my dog. And I just went through that a couple weeks ago, and like everything was expired in there. The food was expired, the medications were expired, everything. So it's just a good reminder to go through that stuff regularly.
Thank you.
Question. Yeah. So then we get to our emergency preparedness kit. So what the heck is an emergency preparedness kit? What do we use it for? Well, we use it for if we have to evacuate, okay? Or you can also think of it like if you had to stay put for a long period of time. You should definitely assemble this kit ahead of time for everyone in your household, including pets. This has always been ingrained into my head because I was originally born and raised in Florida. And in Florida, we have to deal with hurricanes. And so we always had our hurricane kit and our emergency preparedness kit. That way, if we had to stay put, we had enough food and water. But if we had to leave, we also had items to take with us as well. An emergency preparedness kit really helps if it's in a big sturdy bin, such as like a duffel bag or a big plastic storage tote. And then of course, make sure you have those important phone numbers with you in case of an evacuation. And so these numbers should include everything we talked about on the previous slide, but you might also want to include things like hotels, again, those boarding facilities, different family members' contact information, just in the event that you can't get a Wi-Fi signal or something like that. It's just nice to have that paper copy. Your cell phone might die, but maybe somebody else will have one. And if you don't have those numbers, handy, it's so important to have them written down. We can't always rely on technology, especially during an emergency. So things in a disaster preparedness kit should be usually anywhere from like a week or two of food for everybody in your household. And then a week or two of water, which can be a lot for everybody in your household. And then just some basic items that will make you comfortable. So blankets and pillows, enough food. I think we mentioned that, your pet first aid kit. Just think of those items that you might need to grab quickly and what would help you survive and be comfortable in a week or 2 weeks if you're going to be displaced from your home. Batteries is a good one, flashlights again, and all of this information can be found online if you just do a Google search for emergency preparedness kit. If you want to get really super detailed and into it, you can also do a Google search for a bug out bag or a bug out kit, and that has more information as well. So then, preparing for an evacuation or preparing for an emergency is all about being prepared and kind of, making a plan ahead of time. So one of the super simple, easy things we can all do as pet owners is put a little sticker on our front door or on one of our windows that lets emergency responders know how many pets are in the household. You can get these little stickers through the ASPCA. You can also get them through Petco, and PetSmart usually sell them. But they look just like this little picture here. It says, in case of an emergency, please rescue my 2 dogs, my 3 cats, and my 1 bird, or whatever it may be. And then you can have a contact number on there, because one of my biggest fears is something happening to my home when I'm not there and I can't access my home. Like during fire season here in Colorado, I have nightmares of like, oh my God, what if something were to happen? I have a fire at my house and I can't get back to my pets. Like, how do I let emergency responders know to please do whatever you can to save my pets? For me, my pets are my children. And so this is just one super simple thing that we can do. That way, if you have an emergency responder going from door to door to door, making sure or seeing if there's anybody there, this is very simple and effective It doesn't use that much information, and they know that there's pets inside that need to be rescued. All right, so do I stay or do I go in the event of a disaster or an evacuation? Well, it might depend on the actual disaster happening. We kind of touched on fires already. For a fire, we usually know well in advance that the fire is coming, hopefully, and we have at least a little bit of time to get our animals out of there, get our stuff out of there, and then move on. But sometimes for a blizzard or something like that, it's better to stay put. And then sometimes in the event of like a tornado, we don't have that much time. And so we just have to do what we can. And so being prepared for all the possibilities in your area is really important. So depending on where you are in the state or where you are in the country or the world, be aware of the disasters that can happen in your area. Contact your local Office of Emergency Management ahead of time to find out how you can get local alerts and things like that. Of course, there's the TV, the radio, and the internet that can be really helpful. But nowadays, too, you also have your cell phone where they can send alerts to your cell phone. But that's not always effective. So calling ahead of time, again, being prepared, making sure your phone numbers are on list, making sure you've signed up for those emergency notices can help save your life and save stress down the road. You can always visit ready.gov. Or the redcross.org for more information on how to be prepared as well. And then I always like to ask some questions on these slides. You can just think to yourself, is it acceptable to leave your pet secured inside or outside of your home if you have to evacuate? Back in the day, it would have been 100% appropriate to leave your dog with a full bathtub of water and a big bowl of dog food during a hurricane and say, good luck, buddy, we'll be back in a few days. But that's not so much acceptable anymore. If it is determined that humans have to evacuate due to a disaster, your pets have to evacuate as well. And so that can be detrimental to our first responders. And of course, that can be detrimental to your pets too. We've had flooding here in Colorado in the last few years where, if you leave your pets at home, they may not be able to get up to a higher level or get out of the home. And God forbid, something happened that way. So if you have to evacuate, your pets do too. So it's also important to be informed. And how do we recognize a medical emergency? This is where we're going to get into the nitty gritty of things. What are the types of emergencies that a pet might encounter? Okay, so think about that in your head for a minute. What type of emergencies might a pet encounter as we kind of go through this? And is it ever appropriate to call 911 in the event of a pet emergency? Generally speaking, the answer is no. We are not going to call 911 if our pet is experiencing an emergency, unless it is an emergency that directly affects the lives of people. So for example, if there is a dog running at large in the middle of I-25, which is a big highway here in Colorado, absolutely call 911 because human lives are going to be affected. If they hit that dog or if they swerve to avoid the dog, that can be life-threatening to people as well. But generally speaking, in the event of an emergency with your pet, you're going to be calling your local emergency hospital if it's after hours or your local veterinary clinic. And so it's important to have those numbers ahead of time. I have like 50 magnets on my refrigerator right now that show like all the different emergency clinics in and around my area. Of course, I have my regular primary veterinarian on speed dial. I might even have the veterinarian's home phone number. There's things like that some of us that are crazy like have access to. So really the best way to recognize an emergency and be prepared for an emergency with your pet is to first know what's normal. It can sometimes be difficult for your pet sitters to know this as well. So make sure you help familiarize them as well with the situations that may affect your pet. Call a veterinarian if you are ever unsure of a situation. It's always better to be safe than sorry. Cats and dogs, as you guys may know, can compensate very, very well for being sick and or injured. So that's why it's really important to kind of get a baseline. And I'll use my own dog as an example throughout this presentation today, because not only has she been helping me with this presentation for 14 years, but she's 14-year-old dog now, so I have 14 years of baselines that I can go off of, knowing what was normal when she was 2 and 3, and now knowing what is a little different, but still normal for her at 14. And so keep notes. All right, so here's some important information for you guys. So this is pretty standard when it comes to a pet's pulse, breathing, and temperature. In the veterinary field, we call this a TPR. So it's just an acronym for temperature, pulse, and respirations. So for puppies, anything less than a year old, usually have a higher pulse rate. And so they can have a pulse rate of anywhere from 120 to 160 beats per minute. But most small dogs, so your Cavalier King Charles, your Chihuahuas, maybe even a small Cocker Spaniel, 30 pounds or less, are going to have a pulse rate of about 100 to 140. But our big dogs, 30 pounds and over, so like my Labrador and my big Akita, should have pulses of 60 to 100 beats per minute. And the more athletic the dog you have, the slower the heart rate is going to be. So that's sometimes a good thing. If you have a dog, let's see, we'll use Misha, my black lab, as an example. She has notoriously had a pulse rate of 60 beats per minute and sometimes lower, but she has always been that super athlete. So her heart doesn't have to work as hard to pump that blood through her body. So again, that's why knowing what's normal is so important. And then all of our kitty cats usually have a higher pulse rate as well. So 160 to 220 beats per minute. And so if you think about an animal's body for a minute, sometimes our smaller animals are having a higher pulse rate because there's less volume for that blood to circulate through. Our big dogs, like a Great Dane, takes longer for that blood to circulate through the heart. So that's why they have that slower heart rate, and the smaller animals have a faster heart rate. Some birds, for example, just as a comparison, can have pulse rates of like 300 beats per minute or more, depending on their size. That's crazy, right? And then for dogs, normal breaths or normal respirations usually run in the 10 to 30 breaths per minute rate. If they're panting, it can be more, and that's okay. Up to about 200 pants per minute is totally normal if they've been exercising or if they're warm. And the cats also have in that 20 to 30 breaths per minute rate. And then most of us aren't going to be checking our dog's temperatures, although you can. It's just a little different than how we would check our own temperatures. Most dogs and cats are going to have body temperatures higher than ours. So don't panic if you see that 100 mark and you check your dog's temperature. Your dog should have a 100.2 to 102.8 Fahrenheit, and then cats usually are around 100.5 to 102.5. If you ever go to the vet and they check your dog or cat's temperature and it's like 103, that's not necessarily a cause for emergency. It just means your dog or cat might be a little excited. Also for our senior cats, sometimes it's completely normal for them to be just a little lower temperature as well. And it doesn't necessarily mean that there's an emergency. So that's why it's so important to kind of know what's normal for your own pet. So here's some examples for you guys. We have Miss Misha here, 3-year-old female. If we were to check her heart rate right now and it were to be 60 beats per minute, pretty normal from what we just learned. And then we look at her breaths per minute, and they're 24. That can be normal, anywhere from that 10 to 30 mark. And her temperature is 101.2. So healthy dog, she's a young dog. So we know that generally speaking, there shouldn't be anything too concerning here. And then we have Mr. Sam. Sam is a 10-year-old golden retriever. He's a male. So he's a senior dog, so that's important to know. He has a heart rate of 74, so a little more than Misha, and his breaths per minute are 140, so a little high. So maybe he's panting right now, or maybe he's warm, but his temperature is still within normal range, 102.0, so not overly concerned about this dog here. And then we have Mr. Buddy, a 13-year-old Basset Hound, and his heart rate is 60, so not too bad there, very similar to Misha. His breaths per minute are 10, so okay, on the low end of normal, but his temperature is 98.7. So once we start to put all the puzzle pieces together, his heart rate is low, his breaths per minute are low, and his temperature is low, he might be experiencing an emergency. And so that's why knowing what's normal for your dog is so important. Does that make sense to everybody? Awesome. So then we'll get into some other interesting things that can help you guys determine and be a detective to know what's normal in your pet. So in the veterinary field, or even in just pet first aid, we talk about mucous membrane color. And that's a fancy word for what is the color of the gums looking like. Um, Generally speaking, unless your dog or cat has pigmented gums, like if their gums are black, like my dog Misha, it's not a good gauge. And so sometimes you have to look into their eye mucous membrane or just look at their tongue. But every dog and cat, generally speaking, should have a bubblegum pink mucous membrane. So it should be nice, bright pink color, like one of those big league chew bubble gums that you get. That's like the perfect color for a mucous membrane. Colors that are not normal, though, are pale pink, where it goes to almost white, like this little kitty down here on the bottom right-hand side. That's a sign that an animal may not be circulating blood very well. The color blue, like this beagle here on the bottom left hand, is a sign that they're not oxygenating and circulating well. So they might be having a respiratory emergency. Brown or red gums can be a sign that they are overheating or experiencing a heat emergency, similar kind of to this German Shepherd type dog in the top right. And then yellow or jaundice can be a sign that your dog is or cat is experiencing a medical emergency, potentially with its liver. And so knowing what's normal again for your pets is so important. And then we have something called the capillary refill time. So what you can actually do is you can lift up those gums on your dog or cat, and right above the biggest tooth, that big canine tooth, if you just push in on that gum and let go, it'll go pale for a second, and the time it takes to fill back up to a normal color is the capillary refill time. So I'm sure you guys in time have like done that to yourself, where you push on your skin and you push all the blood out, and then you let go and look and see as that blood comes back. Same thing. We're just doing it on the dog or cat's gums. That's the best place to do it there. Okay. You can also find a pulse though on your dogs and cats. Finding a pulse is usually the easiest to do on the hind legs. That's where one of the biggest femoral arteries run through, and so you really get a good pulsating action there. You can also just feel on a dog's chest as well, for a dog or cat, I should say, for that heartbeat. But what I like to do is using 2 fingers. Place 2 fingers up as high as possible, kind of on the inside of the leg, where the leg kind of meets the body wall. And you're going to feel for a little recess in the middle of that leg, approximately halfway between the back and the front. And in that little recess there, you're going to feel the pulse. You don't want to push super hard because sometimes you won't feel it at all. You just kind of have some faint pressure there. So both of these rescuers in the picture are doing a really good job of kind of trying to feel. We don't generally use our thumb to feel pulse. Does anybody know why? No? Because we have a pulse in our own thumb that can mess up our interaction. So always use those 2 fingers if you can. So this rescuer is using her thumb, which she shouldn't be doing, but these are great pictures to kind of see the area I'm talking about. So right in this area is where we're going to go, to slightly below the body wall, and you'll feel a big muscle, kind of the butt cheek, if you will, of a dog or cat, and then that kind of big muscle on the other side, and it's that little recess or indent right there where you're going to feel. So kind of just some landmarks here. We have the big muscle in the back, the big muscle in the front, and then the body wall, and you're going to go right into that indent there. On very chunky dogs and cats, it can be very difficult to find the pulse back there. So sometimes it's just easier to feel for a dog or cat's heartbeat. So you can also do that. So if you lay the dog on their right side, so right side down, so the left side is facing up, that's also a good way to check a pulse or heartbeat. And the reason we lay the animal on the right-hand side is just like us, dogs and cats have their heart on the left side of their body, just slightly more. So we will get a better pulse and be able to feel it just a little bit easier if they are having that left side up. So if you really want to get a good idea of where that heart is, take your pet's forelimb and bend its elbow back until it's kind of in the center of the chest. This adorable little spaniel mix in the picture is kind of doing it for us naturally. So right where her elbow kind of bends back is right where her heart's going to be. And that's kind of the approximate location. This location is also good to know because that's where we would give CPR chest compressions as well. So scene safety. So now that we know a little bit more about what's normal for our dogs and cats, We also want to start thinking about those potential emergencies that can happen. One of my favorite sayings that still helps me today is if you yourself need to be rescued, you're not going to be able to rescue others. And so I really think about that in the event of an emergency. When I'm working with wild animals in my current job, it's my job to keep myself safe first and foremost so that I can then rescue and help the most animals. And so same goes for a disaster. Do not put yourself in harm's way, because if you then need to be rescued, you're not going to be able to help your pets. So before approaching an injured pet or your own pet, make sure you check the scene and make sure it's safe to approach. During a disaster, we have downed power lines, we have boards with nails in it. There can be chemical spills, open water, sewage, that sort of thing. And so we really need to make sure it's safe for us to approach an injured animal so that we then don't also need to be rescued as well. Also have to remember any animal may bite or strike out if they're scared or in pain. This goes for your own pets as well. I have had this happen with my own pets who have been injured. Sometimes that's their only way to tell you, don't do that, it hurts, by snapping and turning around and something like that. So just be aware of that. Protect yourself first. As I mentioned, you cannot rescue an animal if you become a victim too. So approach slowly, be cautious. Pay attention to the dog's body language and the cat's body language, and listen to the sounds the pet is making as well. So we'll kind of talk about that. So what behaviors may actually signal a cat might bite? So cats can have really tricky body language to read. That would be another great workshop. We should do pet body language. But yeah, so for cats, cats can sometimes be the opposite of dogs. So they can arch their backs. Their ears will sometimes be flat to their head, flat to the side or flat to the back of their head. Their eyes might be squinty. Of course, they might hiss. And their tail is oftentimes down or low and might even be shaking. So those are all signs that a cat might bite or attack. And really, for me, the best body language cues on a cat are the ears. If the ears are up, that's a sign that they're content or comfortable. If they're pinned to the side, it means they're just absolutely terrified and are acting slightly aggressive. If they're pinned back, usually it means they're just super scared. But what about dogs? What are some signals a dog may bite? I love this picture of the dog here because this dog is absolutely terrified. So we can see the whites of his eyes. That is probably the best sign in a dog. Dogs will also do similar things with their ears. If they're scared or feeling threatened, their ears will also be pinned back to their head. They won't be floppy and loose. They'll have a very tense and intense kind of look to them or body tension. But that white eye or whale eye, as some people call it, is kind of your best signal. If you see that in a dog, do not approach. Oftentimes dogs will also have really tight lips and just kind of that tense overall appearance if they do not feel comfortable and are going to bite. And it's really important to know a wagging tail does not mean a happy dog. A wagging tail, all that means in dog terms is anticipation. So anytime you see a dog wagging his tail, it does not mean dog is happy. It just it means dog is anticipating what is about to happen. So please be aware of that. You can have a tail that's really tight and straight up and wagging really short and tight, or you can have those nice floppy loose wags and everything in between. But all that means is the dog is kind of preparing for the next thing happening. And so what should you do if an animal is exhibiting these behaviors? You guys are probably smart enough to figure it out. We're not going to approach these animals, okay? We're going to kind of let them calm down, figure things out, and try a better way to get them settled. You can also use some restraint and capture techniques, especially if it's your own pet and you're in an emergency and need to get them to a veterinary hospital. As you approach, allow the animal to smell the back of your hand. Sometimes you can do it from a distance. You don't necessarily want to offer the animal something to bite, but you want them to be able to scent you. And both dogs and cats actually don't have that great of eyesight. They're really good at visualizing movement, but they're not necessarily really good at visualizing facial features or color in some cases. And so that scent really helps them understand, oh, that's my mom or that's my dad. Okay, I don't have to be stressed out. Because, just like when we get stressed in an emergency, a dog may be stressed or a cat may be stressed and not thinking clearly. So observe your pet's body language. Never make quick, herky-jerky movements. Everything should be slow and fluid. Try not to make big, loud sounds that can startle them. And take your time. Rushing through an emergency never goes well, never helps anything. So stay calm, take big, deep breaths, and just kind of move slowly and fluidly. Allow the animal to watch what you're doing and just kind of watch for their reactions. And sometimes you're not going to be able to do things on your own. You may need to call for help, a friend, a neighbor, somebody else to help you. So there's a few capture techniques that you can use in the event of an emergency. You can use a big blanket or towel to kind of scoop up your dog or cat, or you can a burrito for your kitty to get them contained that way. You always want to observe the cat's position. You always want to make sure you're not putting your hands near their mouth, but basically just throwing that big towel or big blanket over them and then scooping them up prevents you from getting injured and also protects them from further injury as well. So you can kind of just use that big scooping blanket and then get them into a carrier, a sturdy box, something like that. If you had to give them medication or needed them to be more restrained, you can literally put them in a towel, wrap the towel over them and burrito them tightly. But that should be something that is best left to a veterinarian to teach you, or something that you can try in person first. You can also do a leash lasso for a dog. So if you have a dog at large running around, or you don't or can't get close enough to a dog to help them, you can actually just take a 6-foot leash, loop it in on itself so it kind of makes a choke collar, for lack of a better term. And then from a distance, from an arm's length distance, you can kind of droop that over the dog's head and pull it tight. And you can do that without ever putting your hands on the dog. So this is a safe approach. This is great for smaller dogs and even up to larger size dogs. With the little dogs, you can also use the blanket technique as well. And again, that keeps you safe. Muzzles are a great thing to have around. We all think as pet owners that, our dogs aren't going to need a muzzle. They've never bit me before. But we can't always say what our own pets are going to do if they're in pain or if they're scared. And so having a basket muzzle around, like this one in the top picture, or just a nylon muzzle down below, is just nice to have in the event of an emergency. We always hope we don't need it, but it sure is nice to have around in case we do need it. You can also make your own muzzle if needed out of that 6-foot leash. So having a 6-foot leash in your emergency preparedness kit or your pet first aid kit is also important to have around. Basically, you make kind of a knot in the middle of the leash, and that knot is supposed to fit in the soft part of the dog's jaw. And then you kind of make a bigger loop that you can tie around the muzzle and then just tie shut and then tie behind their face. And this is a relatively safe way to muzzle a dog kind of from a distance. No muzzle is foolproof though, so it's really important to note. No nylon muzzle, no basket muzzle, no muzzle you make at home is going to keep you 100% safe from a bite. And so just please be aware of that. I have actually had to do this to a stray dog before though, and it worked relatively well. So then once we're on the scene and dealing with an emergency, how do we check for consciousness in the event of a severe emergency? First you're going to pay attention to the situation, make sure it's safe for you to proceed, but then we're going to pay attention to the level of consciousness of the animal. Are they just quiet and kind of depressed, like they're stunned? Are they completely laid out and untended? Are they still breathing? Do they still have a pulse? Do we recognize any blood? And then of course we can check that mucous membrane color and capillary refill time to see, how big of an emergency are we dealing with. The other thing that can be difficult with breathing and cardiac emergencies is sometimes the animal still has a pulse, but it's very, very faint. And they're also still breathing, but it's really hard to tell. So you can actually take a tissue or a cotton ball and just hold it up to their nose and you'll be able to see that tissue or cotton ball move slightly if the animal is still breathing. So that's a really good tip if you're like, oh gosh, I don't know, I'm not seeing the chest rise and fall, but is there shallow breathing happening? There still could be. So we have to ask ourselves, is the animal still conscious? Is the animal still breathing? Do we feel a pulse? And is there any bleeding that we need to get under control? Those are kind of the you'll hear people say the ABCs of first aid. So there you go, the ABCs. So when you're checking on an unconscious pet, we want to check the airways, the breathing, and the circulation. So that's why we use that term ABCs, so that we can remember when we're stressed out in an emergency. For rescue breathing, what I recommend you guys is, we'll show you kind of the basics today, but there's a lot of amazing certification programs you can do locally. Some are just a full day class, others are full week classes, so you can get certified in pet first aid, because really the way you learn this is practicing, all right? But general rule of thumb is for dogs or cats, you want to place your mouth over their mouth and nose. So we're going to seal that entire airway completely. For larger dogs, it's okay. We're just going to cover their muzzle and then breathe through their nose. And to kind of jumpstart their breathing again, we're going to give them 4 to 5 rapid breaths really quickly to kind of see if we can kind of give them assistance that way. If the pet doesn't respond quickly, let's go ahead and check the circulation. And then you can kind of do that again if needed. Hopefully this is on the way to an emergency clinic. Somebody is driving you while you're providing rescue breaths, but we don't always have that luxury as well. And I can't give you an answer on what's better. I get that question almost every single time I give this presentation is, well, should I just get the dog or cat to the vet, or should I practice doing CPR at home? And I can't answer that. There's too many variables in that, depending on the emergency that your animal is dealing with, the distance to the vet clinic, that sort of thing. So yeah, that's a tough one for sure. Let's see, I want to go over some basics here. So a couple of important things when we're doing CPR and giving rescue breaths. Oftentimes we're so panicked and we're not really thinking clearly, but I want you guys to think of your dog and cat's airway like a hose, like a garden hose, for example. I always recommend being on the backside of your dog, because we're going to have the ability to stretch that airway out a little better instead of kinking it. So if we look at these two rescuers in the picture here, they're both behind the dog, but when we kind of look at what they're doing with the airways, our rescuer on the right is providing her dog with a nice open airway. That garden hose, so to speak, is going to be completely free of kinks and available to receive that oxygen. Where the rescuer on the left, unfortunately, is kinking her dog's airway. And so we may not be able to give those full breaths as needed. So position is really important. Let's see here. So we're just going to go over kind of the visual pictures here. So we can see this rescuer is behind the dog, and that's a great place to be for a large breed dog that needs rescue breaths. We're going to close the muzzle tight, that way no air slips out the lips. And then we're going to breathe into the dog's nose, giving 1 rescue breath for every 5 chest compressions. Oftentimes we're really panicked in an emergency, and so we tend to breathe really quickly and give chest compressions really quickly. But think about how that heartbeat works. So in a large breed dog that's really big, remember, they're circulating slower. So just giving a simple 1, 2, 3, 4, 5 is kind of the speed of chest compressions. And then you give that breath, and then you start over again doing 1, 2, 3, 4, 5. And so kind of try and slow yourself down as well. So the goal is to kind of give 100 chest compressions a minute, all right? And we try and continue that for about 2 to 3 minutes, constantly checking for a pulse and breathing as necessary. So this is just if there's one person by yourself. If we have the luxury of having 2 people available, you can do the same thing, but one person can provide breaths and the other person can provide chest compressions. And again, we're not going to spend too much time on this today because it's so much better to learn in person. But at least you have the basics. Remember, this is the foundation. For our small dogs and cats, you can kind of do the same thing, But what you're going to do is, again, with both animals, you're going to lay them on their right side with the left side facing up. But with our small animals, the chest is going to be facing you this time, okay? You're going to place a palm underneath the dog or cat and then another palm on top. And we're going to give chest compressions this way, all right? So again, you'll kind of give one rescue breath for every 5 chest compressions. Because dogs and cats are smaller, they have a faster circulation time. So we're going to try and give anywhere from 120 to 150 chest compressions per minute. And again, we're going to try and do that for 2 to 3 minutes, checking that breathing, checking that pulse, hopefully on the way to a emergency hospital or something like that. Okay. Again, same kind of rules apply if you do have the luxury of having 2 people. You just kind of work in tandem where you have, you're kind of working as a team, one person giving breaths, the other person giving chest compressions. And there's really, in all honesty, there's no right or wrong way to do this in the event of an emergency. Anything is better than nothing at all. So now, do we have any questions? I know I went through like CPR super crazy fast, and that's only because the best thing to do is to kind of do it in person. This next portion of the presentation kind of talks about some of the most common emergencies that may happen. Are we good so far?
I know with human CPR, you'll hear cracking in the chest and things like that. Is that the same with dogs and cats?
Not in my experience. I think because humans, what's funny is I've never done like a human CPR class, don't judge me, just pets. But so I can't speak to the human side of things. What I have been told though is because we're such big creatures that you really have to use a lot of force on our rib cage. So sometimes you do crack ribs, break ribs, that sort of thing. The way that the anatomy of dogs and cats are, you really shouldn't experience that at all. I've never experienced that at all. Could it happen? I'm sure it can. There are even situations that I have heard about where a dog, for example, like dies on a surgery table, and the doctor will actually take their fist and pound really hard on the dog's chest to jumpstart that heart. And so sometimes life-saving techniques can be a little like, whoa. But again, talk with your veterinarian, talk with a certified pet first aid instructor to get those more detailed techniques.
Thank you.
Yeah, of course. Thank you. All right. Any other questions before we move on? Cool. All right. We're going to talk about choking now. So signs and symptoms of choking. So it's not always super clear like we think it is. It's kind of like when the news talks to you about what drowning looks like in people. It's not always splashing and calling for help and that sort of thing. And same goes for choking as well. Oftentimes, if there is something lodged in a dog or cat's airway, and that's usually the cause of what gets them to choke, they may act anxious or frantic. They might be pacing, walking back and forth. They might be gasping. They might be making strange noises. Or it might be something as simple as they're pawing at their face and their mouth. They're rubbing their face on the floor, just kind of acting very, very frantic. At some point, if they are not getting enough oxygen in, their gums will start to turn blue or white in some cases. Like I said, you may be able to hear those loud breathing noises, or they may be struggling or gasping. In addition to my black lab, I also have a big white Akita. And when he was a puppy, he was dumb and he would inhale his food that he was eating. And so every few days, all of a sudden we'd hear him and like start gasping and choking. And the first time it ever happened, we kind of looked at him and was like, what's going on? Like, did it just go down the wrong hole? Did he get it stuck in his gums? And we could see his teeth kind of curling and he was making weird movements, but no noise was coming out. And then all of a sudden I saw his gums turn blue and I was like, oh my God, he can't breathe. And so I, rushed into action, and we'll kind of show you the next steps here. So it doesn't always look like what you think it will look like. While these next few slides are going to be really humorous, they can also save your pet's life. Right now, there's a lot of, I guess they're not really memes, but they're like infographics of drawings of like how to stop your dog from choking or how to stop your cat from choking. Basically like the Heimlich maneuver for pets. I really like these next series of photos because they actually show you visually like what you should be doing. So for a small dog or cat, depending on their level of consciousness, these are two great techniques that you can use. First and foremost, you're going to open their mouth if you can and pull their tongue forward, okay? You can do a quick finger sweep inside of their mouth, careful not to get bit, and careful not to push the object back further into their mouth. So kind of taking a sweeping movement with your tongue, or excuse me, with your finger pulling towards you can sometimes dislodge an item that way. Or you can use these abdominal thrusts. So in the picture of the very super chunky kitty, basically you're going to go right underneath their rib cage and kind of push in and up. So it's not just a push towards you movement, it's a push towards you and up movement. And sometimes that thrusting is enough to dislodge an item. Again, do another finger sweep because sometimes that item is dislodged but not completely out of their throat. And you just kind of keep doing that until that item comes up. If it can't dislodge within like 5 sharp blows, you can try some back blows as well. So for this cat here who's hanging upside down and kind of looks silly, this would be for something you would use after the animal has gone unconscious. And so you can do kind of 5 sharp back blows to kind of dislodge the item, similar to like you would do an infant. I've seen people do that with an infant as well. And that, again, the Heimlich maneuver can sometimes be kind of a harsh looking thing that we have to do to our animals in order to get these items dislodged. For medium to large size dogs, you can do a similar thing. If they're laying on their side, open that mouth, pull that tongue forward, do that finger sweep. Again, being careful not to push an object further. You can place a dog on their side if they are unconscious enough or willing. Sometimes they're so panicked they won't do that. Make sure you place that head and neck in that neutral neck position. That way you're elongating the airway. Place the palms of your hands right below the rib cage. So this is a really great picture of this rescuer here. And then again, you're going to give those 5 rapid abdominal thrusts towards you and upwards towards the dog's head to dislodge that object. You can also do back blows as well to see if that object dislodges. The most common things that are going to get lodged in your pet's mouths are like rawhide bones for dogs are a big one. Small balls and toys that weren't the appropriate size, so maybe they're just a little bit too small. The other things that we have to consider are food items. One of the biggest culprits, believe it or not, are like chunks of cheese. So people will give their dogs or cats too big of a chunk of cheese. They'll swallow it all excited, and what happens is when that cheese gets moist, it expands and it gets stuck in their throat. So I've seen very scary things happen with like string cheese, for example, like mozzarella, the softer type of cheese, can actually be really dangerous. So just be aware of those sort of things. These are some other great techniques to help dislodge something in your pet's throat. I tend to like both of these ones best, whether it's a medium-sized dog, big dog, or even kind of a smaller dog cat. I'll use the wheelbarrow technique. So again, you kind of ball up your fists underneath the dog, and then you kind of give those thrusts upward, like this rescuer is doing. And you can give thrust upward and again towards the dog's head. And I have found this to be the best way to dislodge an item. I've even given this presentation virtually years in the past, and I had somebody call me a couple weeks after the presentation and was like, I'm so glad I paid attention during your presentation. My Basenji started choking one day, and I used the wheelbarrow technique and was able to get the item dislodged. So thank you so much. So these techniques can help. You don't have to exactly know what you're doing. Anything is better than nothing in the event of an emergency. You can also do these standing abdominal thrusts as well, but I find them a little more difficult, especially with a big dog. What tends to happen is the bigger dog just tends to topple over. So unless you have a very willing participant, it can get hard to dislodge an item that way. So I really like the wheelbarrow technique. I also like this technique as well. I don't have a name for it. I used to joke and be like, reverse cowgirl? No, I don't know. I don't know what this is, but this is another good way, because our hands move back and forth the way that we do, like when we think about walking. This is sometimes the best way for us to remove an object from that's lodged. So you stick the dog kind of opposite of you, and then you're just going to give those thrusts towards the dog's head. And that is a really another great way to get an object removed as well.
Emily, quick question.
Yeah, please.
Can you show us how you would hold your hands in that?
Sure, and I if you guys can humor me, I actually have a dog in here. I might be able to show you.
Thank you.
See. Yeah, come here, Mish. So let's see, let me move some things out of the way. I wasn't planning to do a demonstration, but this is okay.
Will you, I know, sorry, will you take your presentation off so we can see you full screen?
Oh, sure, yeah, hold on. Let's see here. We'll stop sharing for a second. Can you guys see me? Okay. Poor dog, she's been through this before. Let's see here. So there's Misha. So we'll get her sideways here. Let me know if you guys can or can't see. Can we see okay? Okay. So what I would do, stay, is I kind of hold my hands like this. Okay, so underneath her, that's all I'm doing. And so I will actually go this way. I really do like this way better because if she was choking, what I would probably do is take my hands and then I can just push right into her diaphragm here, if that makes sense. So I'm kind of like cupping my hands underneath her that way. Does that make sense? So that's my favorite way to kind of dislodge something from a dog or cat.
Thank you. That was helpful.
Does that help? Okay.
I wasn't sure how to hold my hands or if like.
Yeah. Because sometimes like in a panic, like you can go like this also, like just with a fist, but I feel like locking the hands really helps. And then you just make sure you have all that leverage you need, you know, for moving your arms and that sort of thing.
Great. And then you would just push up or well, yep. I like that way too, because you kind of have a better handle on them. Yep, like you're there between your legs. Yeah,
exactly. So you can kind of manage them. Come here this way. And then yeah, you can just kind of grab this way and then you can really see the movement that you can do and you kind of push this way. And of course she's an old lady, so it's really easy to move her around these days, but hopefully that helps.
It does, thank you. And thank you, Misha.
Yes, yeah, it's kind of, they're kind of like weird body positions to get yourself into and also to get your pet into, but you know, they can definitely save lives. Good job, lady. Okay. Let's see here, let me share my screen again. Okay, you guys. Cool. So now, any other questions before we move on? Those are, I know I'm going through this really quick, but again, just this is the basics, this is the foundation. Don't feel like you have to remember everything. And believe it or not, you'll remember more than you think you do. Okay, so we're going to talk about a few other things now. We're going to talk about shock. So shock is the body's response to a change in blood flow and oxygen to its organs and tissue. Shock is very, very common in any kind of traumatic injury. And it may be a result of sudden loss of blood, like being hit by a car or even getting like a major laceration. So those traumatic injuries, heart failure or organ disease can cause an animal to go into shock. A severe allergic reaction, a bee sting, a spider bite, shellfish. I've had a dog that got into like crab legs and like blew up and had an anaphylactic shock. So allergies can happen as well. Infection that's circulating through the body can cause an animal to go into shock. So what do we do? So first and foremost, we have to assess the pet's ABCs. And if they are in a life-threatening situation and having shock, you know, make sure we are checking the ABCs and we can perform CPR if needed. But really, for the most part, what we're going to do with shock is we're going to control any bleeding if it's present. That's the most important thing to do. And we'll talk about how to do that here shortly. We're going to keep the animal warm. Oftentimes what happens when an animal goes into shock is all their blood goes to their brain and to their internal organs to keep them alive. So that means they get cold and their extremities tend to get really cold. So our job, the best thing we can do is keep them warm during those situations. And you can elevate the hind legs if needed, if you do have a dog or cat that is slightly unconscious, because again, we want all that blood to go towards those internal organs and their brain, and then just get to a vet as soon as possible. Kind of the best things to do. So elevating legs, keeping your animal warm, getting them to the vet, that's gonna be all the things that help with shock. And then wounds. There's all sorts of different wounds our animals can get. My dog has gotten the majority of them over her lifetime. They can get little things like abrasions. They jump out of the car funny and they scuff their nose or their face or their pads. They can get lacerations from running and accidentally cutting their tendons. They can get punctures from things, either other dogs or plants or objects. And they can get items embedded in them. Here in Colorado, we have to deal with grass-ons a lot, which are these horrible little heads to the grass that are like an arrow, and they can actually burrow into our pets. It's terrible. They can get burns and things as well. So if we want to talk about basic wound care, so this is basic. First and foremost, we're going to wash our hands so we're not providing any bacteria or additional bacteria into the wounds. Bonus points if you have gloves in your pet first aid kit that you can use. And we're going to kind of clear any hair and dirt and debris from the wound itself. So for pretend, we can say our dog or cat has a wound on their paw. And so that can be a real dirty area, an area with lots of movement, lots of different tendons and bones and things in there. So you can just, with some water from your sink, or if you have saline water that you have in your pet first aid kit, you can kind of flush the wound with that, get all the hair out of it, get all the debris out of it. You can also clip the hair in the area if needed, but try not to use scissors. I've had many a panicked pet owner try and cut hair away from a wound and then accidentally cut their dog's skin even further. So be cautious with that. Grooming clippers are the way to go. I've also had pet owners in the past that try and trim mats off their dog and cat and then accidentally cut the skin as well. So scissors are no bueno when it comes to using on your pets. You can flush the wound like we talked about, and kind of that surrounding area with that saline water or just nice warm water. You don't want to be too hot or too cold, just kind of room temperature is good. And you always work your way from the center of the wound out. That way we're not going to constantly be wiping debris back in and out of the wound. So you start in the middle, kind of work your way out, and that's the best way to take care of it. And then you can do this multiple times if needed, just flushing and washing the wound, and just continue to clear out that debris if needed. So for serious bleeding, you have an arterial bleed. If it's a rapid or profuse type of bleeding, if it's kind of rhythmic in motion when it's spurting, or if it's difficult to stop bleeding. That, of course, is an absolute emergency. You need to get to a veterinary hospital as soon as possible. The best thing to do for any kind of wound for bleeding is just pressure. And I think we'll talk about this in the next slide. For bleeding from the vein, it's oftentimes a little slower, it's less profuse, there's not going to be any kind of rhythmic motion to it, and it's much easier to stop the bleeding and generally less dangerous unless a large vein is involved. So let's see here, I think, yeah, cool. So the best way to control bleeding is through direct pressure. And this goes for us as well, just general first aid. You're going to want to apply direct pressure to a wound using gauze, using cloth, using clean material, or anything you have available. I have used socks because that's all I had. I have used my hoodie because that's all I had on a hiking trail. Sometimes you have to be creative, but you don't want to keep releasing that pressure to chuck the bleeding. You don't want to keep taking something on and off. So what you're going to do instead is apply direct pressure. And if you keep seeing bleeding coming through the gauze or whatever you're using, just keep adding to it, okay? Just keep adding on top of it, get to that vet clinic, and just keep applying that pressure. It's the best thing you can do. If you have pet first aid material with you, you can also provide a pressure bandage. Now, these pressure bandages are for short-term use only, so to get you to a vet clinic where they can help you. But basically, you're going to take that gauze that you have in your pet first aid kit, your roll gauze, or any other kind of clean material with you, and you're going to wrap that wound. We have to first make sure there's no breaks or anything like that because we don't want to cause a broken bone to get out of alignment, but basically just applying a pressure is going to be your best friend. So I use this example. One of the most common places that a dog or cat gets a cut is in between their paw pad. So if you look at this little puppy paw here, compliments of Misha, people generally know that that bottom paw, they have the 4 little finger pads and then that flat fleshy pad, but then they also have a carpal pad high up. And most people don't realize when a dog is running full speed, all of those pads hit the ground, including that upper one. And so what oftentimes happen is they get a laceration in between those pads because all of those pads are hitting the ground when they're running. And so for this kind of sequence, this is one of the most common lacerations and wounds, so we'll kind of focus on this area. So this rescuer here is applying pressure to a fake laceration here. So apply a pressure with some gauze pads. You don't keep looking to see what the bleeding's doing. You're just going to apply pressure. And then you're going to use your roll gauze and kind of roll the gauze over your hand and over the gauze pads on the inside. And you're going to wrap it nice and tight, okay? You're going to leave your pet's toes sticking out of that bandage because we're going to want to check for swelling as time goes on. And if you wrap the whole foot in a bandage, you're not going to be able to check for swelling. Does that make sense? Okay, so we have the gauze pads inside, we have the roll gauze out like this. Then we're going to use what I call vet wrap. And it does have another name at Walgreens and CVS in the human world. I just can't remember the name of it. I think it's something like cling gauze or cling wrap, but I can't remember. But vet wrap is what it's called. Now, vet wrap can sometimes do more harm than good if you don't know what you're doing. So when I wrap a wound with vet wrap, I will purposely wrap my 2 fingers on the inside of that wrap and then pull my fingers out. And the reason I do that is that ensures that I'm not going to put the vet wrap on too tight because we don't want to stop the circulation. We just want to stop the bleeding. So we're going to wrap the entire paw in vet wrap. I usually leave a little bit of the roll gauze sticking out on either side, but it doesn't really matter. And then we're going to tape it in place because oftentimes what happens is we'll get this beautiful wrap on and we're like, oh my God, I did an amazing job. I stopped the bleeding. And then the dog starts walking and the entire wrap falls off and the bleeding starts again. So tape is really helpful. So I usually tape the top of the wrap and the bottom of the wrap. But notice in this picture, her little tootsies are still sticking out. So I can still check for swelling just in case. But this will at least help keep your wrap in place and continue to control the bleeding. Ta-da! That's what it should look like at the end. So that's kind of the best thing to do there. And you can use this type of wrap anywhere on the body, but this is, toes and legs are probably the most common thing that our dogs and cats cut or get injured. The other most common thing that they get cut and injured is their snooter, but that's a little harder to stop the bleeding and control that way. So it usually doesn't bleed as much, luckily. So pressure points for controlling bleeding, these are good to know as well. On the front limb, you can press 3 fingers up and into their armpit on the side with the bleeding limb, kind of up in this area, and sometimes you can help kind of stop the bleeding that way. You may have noticed when you go to the vet clinic and your pet has blood taken, the veterinary technicians will also use these pressure points to hold off the vein when we're giving blood or when we're giving medication and that sort of thing. In the back limb, you're going to press 3 fingers on the area of the inner thigh where the leg meets the body wall. That's that same place where we're checking the pulse. And so that can also help stop bleeding if you have some significant bleeding in a back leg. For the head, you can press 3 fingers at the base of the jaw, kind of right where the jugular would be, kind of at the angle of the ears and whatnot. And that's a good place to stop bleeding somewhat on the head. Like I said, it can be a little more difficult when we have bleeders on the head. And then for the neck, you can press 3 fingers into that soft groove, on the windpipe there. That's also part of the jugular. But do not apply pressure to the windpipe itself because we don't want to stop our friends from breathing. Does that make sense? The best thing that I recommend just to familiarize yourself with this stuff is later on kind of play with your pet and kind of see where those grooves are on their neck, see if you can feel those veins or those arteries, play on those internal limbs, in the armpit area and in kind of the groin area of the dogs and cats, and see if you can kind of find those fleshy landmarks I'm talking about. And if not, ask your vet next time you're there for an appointment. We used to have people come into the vet clinic all the time and just say, hey, can you show us a few basic pet first aid things? And usually you don't even need an appointment. You can just call and just say, hey, can I stop by on your lunch break? Or can you just show me a few things in the waiting room really quickly? With COVID, things may have changed now with your vet clinic about who's allowed into the vet clinic and who's not, but it never hurts to ask. Pad wounds. These can be some of the most difficult to control because it's such a thick, weird, vascular area on your dog or cat. First and foremost, just like any wound, try and remove foreign debris. Apply that direct pressure to stop the bleeding. You can use warm, soapy water, saline solution like we've talked about. And then you're going to want to dry the foot. Pat that dry. You can always use a little bit of antibiotic ointment on there. And then you're going to bandage the foot in the same way. The only difference is, depending on where the laceration is, you may actually have to wrap the entire paw. But we want to definitely keep making sure that those toes are not swollen and toes are not cold, because that can be a sign that we've put too much pressure in that area. So we can always loosen the bandages as needed. These can take a really long time to heal just because of the nature of the pads. I once had a dog, I'll give you the short version of the story. It was a very hot day. The only part on a dog and cat that sweats is their feet. A lot of people don't realize that. And my dog jumped off a huge boulder and landed funny and ripped every single pad off of every single one of his feet. We were 2.5 miles up a hiking trail. So we had to, I shouldn't say we, my husband had to carry my 80-pound lab down the hiking trail. It was the day I knew I was going to marry him. But it took weeks for those pads to heal. And my poor dog had to have all 4 feet wrapped for weeks. He could barely stand. It was a very painful few weeks for him, but he got through. Eye and ear injuries are also some very common injuries that can happen to our pets. Again, with eye injuries, it's nice to kind of hold them still, like this rescuer in the picture here, kind of in between your legs like that. That way you can have more rotation of holding the muzzle, looking in the eyes, looking in the ears. You can always flush eyes out with sterile saline or saline solution. It's the same kind of makeup in that water that it is in our own eyes. So saline solution is great. Tap water is fine too, to remove any kind of foreign debris. Look for any kind of discoloration in the eyes, redness. Sometimes you can see scratches on the surface of the eyeball. Sometimes you can't. So sometimes if you see a dog squinting its eyes, or there looks like there's obvious swelling, or they can't close their eye, again, knowing what's normal is really important. Try not to let your dog rub their eyes if you do suspect an eye problem, because that's only going to make matters worse. If the problem persists, get to your veterinarian as soon as possible. I have seen crazy things happen where, dogs who like to rub their face on the ground have actually gotten carpet fibers like stuck in their eyeball. And so they really need help to get that flushed out. For ear injuries, you can, of course, look in the ear, remove any kind of foreign debris with a Q-tip or a cotton ball. You can use ear cleaner and ear flushes, but again, be careful not to move any foreign objects further down the ear canal. I personally find that sometimes ear cleaner can make things worse, but every veterinarian has their preferred method of kind of dealing with ear issues. You may also notice that a dog or cat is shaking their head, scratching their ears, or there's a strong odor. And that can be one of your first clinical signs to something going on with your pet's ears. All right, and then of course you have the injuries to bones, muscles, and joints. These are usually pretty easy to see because it means your dog or cat's not working normally. So if you notice things like limping or not bearing weight on a limb, or if they're painful when they're touched in a certain area, or you notice obvious swelling, those are all signs that something ain't right and that it's probably an emergency. Fractures can be a little more obvious. They might be as simple as the clinical signs above, the limping, non-weight bearing, but sometimes we have significant disfigurement or obvious lameness where they just can't put any weight on a limb. They'll have obvious pain. Or you may have suspected, visual trauma, such as a bone piercing through the skin or bruising or swelling. And of course, those are medical emergencies. Caring for a broken bone, if you happen to be on the hiking trail, for example, with your dog or cat, here in Colorado, you can have both. And it was going to take you a while to get to a vet hospital. You can splint or immobilize an animal's leg. I have used newspaper, I have used a magazine, and then just taped it around the dog's legs. Oftentimes breaks are extremely painful though, so the less movement of those bones, the better. And it's oftentimes just better to get directly to a vet, keep the dog or cat calm, keep them laying down, keep them from putting pressure on those legs, and usually just have your vet do the work if possible. Now, caring for a broken neck or back, obviously that's a severe break. It is an emergency. The best thing to do in these situations is just to keep the animal immobilized as much as possible. Try not to move them as much as possible, and then just get them to an emergency clinic as soon as possible. Some signs of a broken back or neck would be things like sometimes the front legs are really stiff. That means their spinal cord is affected. They may be unable to move their head. They may be unable to move some of their limbs, front or back legs. Sometimes they will dribble urine or feces because they can't control their back end. We very rarely will see an actual divot in the spine, but sometimes you can see that as well. Car accidents, I'll kind of glaze over this and just give you guys kind of my best practices for if you do encounter a dog or cat that has been hit by a car. First and foremost, always make sure you're looking around and under your vehicle before you're backing up, especially in the winter. If you live in an area where you do have stray cats or feral cats, things like that, they oftentimes will seek the heat of our engine in the vehicle so they can climb up into the vehicle. Or they will lay behind a tire because the tires are warm. So always give a little look around the vehicle. Keep cats indoors, of course, and that's one of the best things we can do to keep our cats safe. Always keep dogs as indoor pets as well. Make sure they're properly leashed. Make sure your yards are properly secured. Never ever transport a dog in the back of a pickup truck. I've had people that have, well, I'll spare you all the details, even people that have kenneled their dogs in the back of a pickup truck or leashed their dogs in the back of a pickup truck. I have seen horrible situations happen in those situations as well. So it's best just to keep your dog in the cab with you and not in the bed of the pickup truck. Always use a carrier when transporting your cat. Over the years, I've seen lots of creative things that people have done, keeping cats in pillowcases, laundry baskets, and other kind of strange things. And the best thing to do is just keep them in a secure kennel for their safety and yours. If a pet has been hit, take the pet directly to a veterinarian. Of course, that the pet might get up after being hit by a car, and because they're in shock, kind of be like, I'm fine, I can walk, things are great. But anytime there's a trauma like that, just get them right to the vet to make sure everything is okay. Many injuries don't show up right away. And as we talked about before, many animals compensate really well for injuries and illnesses. So it's important to be aware of that. Round in the corner here to our last few slides, you guys. I know this is a lot of information. Other things that can happen, especially with cats, are abscesses. An abscess occurs when bacteria gets trapped underneath the skin. Usually it happens due to a bite wound. Bites always abscess because it traps that bacteria underneath the skin. Sometimes we don't see an abscess right away, but we can see other symptoms. And those symptoms may include a fever. The cat might start getting kind of hot to the touch. You might notice a fluid-filled lump somewhere on their body. That lump will oftentimes radiate heat. It'll feel really hot to the touch. If you know that your dog or cat has recently been in a fight with another dog or cat, and they're just not acting right, that can be a sign that there is an abscess somewhere. Or if they've suddenly stopped eating or drinking, that can be a sign that something is not right. So take the pet to a veterinarian to have the abscess cared for. Please do not try and lance the abscess yourself. That never goes well. Pets will generally need to have antibiotics afterwards, and then a wound treatment as well. So we have to kind of treat the abscess itself and then the animal systemically. Burns can happen too. We're getting ready to move into the winter months where we're going to have our fireplaces on and cooking things in the kitchen and all those amazing, wonderful, delightful smells that bring dogs and cats into the kitchen, candles burning, that sort of thing. So burns are classified by the severity based on how deep those burns go into the skin walls. Cats are oftentimes more commonly burned than dogs are. For a couple of reasons. Cats will oftentimes jump up onto a hot stove, not knowing that it's hot. So they don't think, they're just used to jumping up on the counter. They jump up and then they burn their paws. They also have those tails that just kind of have a mind of their own, and they will wag into the fireplace or wag over an open flame, and then they can get burned that way. The most common places dogs usually get burned are on their snooter. They're sticking their nose into things that they don't belong. And so that's usually where they'll burn themselves on their nose or on their lips, that sort of thing. So those large superficial burns can be just as dangerous as those deep, small burns. So keep that in mind as well, as you might see an itty bitty burn on your animal and say, it's probably fine, but it probably should still be checked out by a veterinarian as well. And there's lots of different types of burns too. It's not just from an open flame. Heat itself, dogs and cats are notorious for like laying too close to like a fire pit or to the fire itself or to a heat source. And then they can accidentally overheat or get too warm or get burned that way. But there's also chemical burns. I have seen poor kittens who got into like toilet bowl cleaner and got severe burns on their legs and their feet from the chemicals. Oil and grease is another one. If there's hot oil from cooking or a pan falls and gets splattered on a dog or cat, those are severe burn wounds that need to be addressed. So lots of things can happen, especially as we move into the holiday seasons as well. There's also different types of burns in the form of electric shock. Generally, electric shock can happen when pets are biting electrical cords. So you can do your best to be prepared and just prevent these things from happening by keeping cords wrapped up, keeping animals away from cords, puppy and kitten proofing your house. Puppies and kittens are definitely more likely to get electric shock. My Akita Burley, when he was a baby, chewed through a fan and got shocked. He had a little tiny black spot on his tongue, and then his face swelled up, and then we thought horrible things, but luckily it was relatively minor, but we had to get him to a vet clinic. The pets may also have difficulty breathing depending on how bad that electric shock was. It can actually cause fluid to form on their lungs. So these electric shocks may not just be superficial. It can really do some major damage to their body depending on what that electric current did. If you suspect your pet has been shocked, just take them to a veterinarian, get them looked over. And like we talked about, you can prevent that by getting plastic sleeves to cover cords, placing cords out of the way so they're not accessible, unplug cords when you're not using things like the fan, and other items, and then provide your pets with a lot of toys to chew on so that they don't feel bored enough to go chew on cords. And then you can also spray cords with a deterrent like bitter apple spray. There's another super disgusting one called bitter orange that you can get from your veterinarian that just absolutely tastes foul because some dogs like bitter apple spray because they're weird. So caring for sudden illness. So what do we do in the event of some of these emergencies? There are different types of sudden illness that may require first aid. The cause may be clear in some cases, but sometimes it's not. Oh my gosh, I have a story I could tell you guys that would be a perfect example. Observe and watch for life-threatening situations and provide care as needed. If the followings happen, this is kind of what we can do. Oh, I was like, what is that last part? So a story about Misha really quick. Just a few years ago, we had been hiking with her and we happened to hike through a campsite and we had a great day. We had stopped and talked to a few campers, and on the way home, we noticed she was kind of like unstable in the back of the vehicle. We were like, that's weird. Maybe she's old. Maybe the hike was really hard on her. And by the time we got home an hour later, she could not walk. She jumped out of the car, completely fell over, splattered. She was leaking urine, and I was just like, oh my God, what has happened? Like, she must have hurt her back. She must have had a stroke. Something horrible happened. So we immediately turned right back around, went to the emergency room. So this is a perfect example of like, oh my God, sudden onset of illness, like what's going on, and I checked all her vitals. Her heart seemed to be fine. Her pulse was, or her respirations were a little slow. Everything seemed to be within normal ranges, but I knew that wasn't normal for her. Long story short, we got her to the emergency room. She, at this point, couldn't stand. I handed her over to the emergency staff. And a few minutes, they would come out and they're like, so your dog's fine, but is there any chance that she could have gotten into some marijuana? And I like whip around and look at my husband, and he's like, no, there's like nothing, there's nothing there. And come to find out, we think that as we were hiking through this campsite, she probably found some edibles and like snarfed them on the ground. And so there is something called marijuana toxicity that dogs can get, and it can be fatal. It can be very dangerous. But she had the like stereotypical clinical signs. So all we could do is give her like a bunch of fluids at the emergency room, and she just had to ride out her high. But it was completely awful. Like I thought my dog was dying, and here it was just this simple thing that we had to get through. So you never know when, sudden onset of something can happen. Any questions before we move on to like the final stages of this? All good? All right. So collapse, we've kind of talked about this a little bit. If an animal collapses, it's obviously in serious trouble. There's Misha, for example, she collapsed getting out of the vehicle. So that was absolutely a medical emergency. The pets may be in shock. It could be heart disease. It could be a number of things at the beginning of a seizure. And so regardless of the cause, it's important to take those steps I kind of just talked about. So check the ABCs. I checked her airways. I checked for bleeding. I checked circulation, and all of that was fine. I didn't need to perform CPR, thank goodness, because she was still upright. But we also have to check for shock, cold temperature, keep the animal warm, and then get to a veterinarian immediately. So those are those things that can kind of help save lives in those moments of distress. Seizures are another common thing that can happen. Most seizures are not harmful, although they can be absolutely traumatic to the people that have to witness them. Seizures are generally caused by a genetic trait, a medical problem, an unknown cause. Sometimes medications can cause them, or a toxin in the environment. If this is a pet's first seizure, it's very important that you take your pet to the veterinarian immediately. That way we can determine the cause. If a pet has a seizure, these are the steps that you can take. Make sure that the pet is in a safe place, away from staircases, away from table corners, that sort of thing. Make sure you time how long the seizure takes. Usually they're only happening for about 30 seconds to a minute. It just seems like it's happening for hours when it's actually happening. Keep your hands away from the animal's mouth. Of course, they don't always have control over their function and may accidentally bite you if you're not careful. Try not to overwhelm the animal during and after the seizure. And if necessary, you can start keeping a log of when these seizures happen, how long they are, and that sort of thing. The yellow lab mix there at the bottom is one of my old dogs that I used to have, Nico. And Nico, for a period of like 40 years, had idiopathic seizures, and we had no idea why. They just started one day, lasted for 4 years, and then they stopped. So no idea what was going on there, but usually they would happen when he was sleeping, and all of a sudden he'd wake up, go flying out into the other room, fall over, and just start, shaking and going crazy. And so all we would do is just kind of hold him down gently. We would try not to talk or overwhelm him, but just kind of like gently hold him down. He'd usually, express his bladder during that time. And then when he would come back to, you could tell he was really upset. So he would oftentimes like pace around the house for a while. He'd grab this toy and he'd just carry a toy around in his mouth for a while. So you could tell that they know something is going on to them. They probably feel different than they did before. And so it's just important to kind of keep things calm and mellow for them. Try not to rush and overwhelm them. And then with your veterinarian, kind of determine the cause. We never determined the cause of his seizures. So kind of interesting that way. Heat stroke and heat exhaustion is something that is also very common, especially here in Colorado during our summer months. If a pet is too hot, their gums may oftentimes appear red. They may have little tiny blood vessels that rupture in their eyes and in their gums. You can usually help a pet with heat stroke that is not too advanced. That's like 104 or lower. The worst heat stroke I've ever seen was a dog had a body temperature of 107. And that was a severe medical emergency. And unfortunately, I think that the pet parents eventually decided to euthanize that dog because he was kind of too far gone. But as you guys know, dogs and cats can't sweat. They don't have sweat glands like we do. So they don't release heat like we do, and they don't cool down like we do with sweat. So instead they have to pant. So they're pushing out all that hot air, trying to bring in cooler air. And if they don't have, and if they're just trapped in a hot car, they're not going to be able to get any of that coolness. So there are things you can do to help them though in an emergency. First and foremost, you have to cool your pet down. So if you have a garden hose, something like that, it's totally appropriate to just spray down the pet completely. Things I have done in a clinic setting or at home is use alcohol, like spray alcohol, and you can spray their underbelly and spray their paw pads, because that is usually where they have a lot of superficial capillaries and superficial blood vessels. And so it's easy for them to take in that cooling alcohol very quickly into their body. Make sure you're continuing to check their temperature though, because you could actually cause them to go hypothermic very quickly. So you can actually make them too cold, which is another life-threatening situation if you're not careful. So if you suspect that your pet has heat stroke, just get them to a veterinarian as soon as possible. You can quickly, get them cooled down with water or whatever, but just get them to a vet. And then of course, never leave a pet in a parked car with the windows up or even with the windows down. Heat stroke can happen in just minutes, just 5 minutes or less in some cases. General rule of thumb is I like to think of a vehicle, if it's usually a vehicle is 20 degrees hotter inside than the outside temperature. So if it's an 80-degree day, it could be 100 degrees or more in that car. And if you think of our dog's normal body temperature, a normal dog body temperature is 100 to 102. So if it creeps up at all above that, that can be a serious emergency very, very quickly. But then we can have the opposite happen, hypothermia and frostbite, which can also happen here in Colorado and other parts of the country. When body temperature drops, when body temperature drops, the heart rate and breathing slow, okay? So hypothermia can cause neurological problems, heart problems, kidney failure, and then of course, respiratory distress as well. And then frostbite can cause damage to the superficial tissues of the skin. Oftentimes frostbite happens to the tips of tails, ear tips, the pads of the feet are kind of the most common areas affected, the nose in some situations. And the best thing you can do in a situation like this is slowly warm them back up. Warm their body with a blanket, or use room temperature water to warm their paws and legs. Don't use hot water. Just like if you've ever gotten into a hot tub and you're like, it's really hot. Oh, I gotta ease into this one. It's the same way if your dogs are experiencing hypothermia or frostbite. Warm water can actually hurt them. So we wanna kind of start it out slowly. And then poisoning, we just have a few more slides to go, but this is one of the most important slides that I can share with you guys today. There's a lot of common household poisons that we all keep around that we probably don't even know that we have in our house right now. Poisons can be eaten, they can be inhaled, and they can be absorbed through the skin. If you suspect poisoning, you can contact a veterinarian immediately, and they'll kind of walk you through what you can and can't do in those situations, depending on how long ago the poisoning incident happened. You can also contact the Animal Poison Control Center, and this is their phone number. So write it down, take a screenshot, whatever you can do. They do charge for their services, but it is well worth it. I have used their services multiple times because I have very naughty dogs and a Labrador at home that eats everything and has eaten everything her entire life. Her new thing is paper. She eats newspaper and toilet paper and tissues, and not sure what's gotten into her lately. So you can, depending on the poison, induce vomiting. And I much rather you talk to your veterinarian about what to use and the amounts to use instead of sharing that here. Because there's good things to do and there's bad things to do. And if you don't exactly know what you're doing, you can cause more harm than good. Symptoms of poisoning, though, are what you might expect. An upset stomach. They might actually have labored breathing. You might notice some drooling. This is for dogs and cats. Increased or decreased heart rate. They might have hyperactivity, or they might have the opposite and they're really lethargic. They might have an increased thirst or lack of thirst or hunger. They might have really dilated eyes, or they might start stumbling and staggering and acting like kind of a drunken sailor. Sometimes they can get seizures and tremors from what they've eaten, or complete loss of consciousness. So as you can see, there's a lot of different symptoms that our pets can get from the things that they eat. I would say, let's see if I talk about this on the next slide or not. We'll come back to that. Some of the most common household things that our pets get into are plants. So if you are a plant keeper, like I am, I have lots of plants in my house right now. Please know the common names of them and know which ones are poisonous. Almost always in Easter time, everybody gets those beautiful Easter lilies, which are gorgeous, but they are lethal to our cats. And so we get a lot of calls during that time of cats getting into the lilies or poinsettias and Christmas. Dogs and cats will get into that and then start puking. There is a type of plant that I keep in my house called a Dracaena. I can't remember the common name of it, but it is very fatal to a dog or cat if they ingest it. So we just make sure we keep that plant in a back bedroom that our dogs don't have access to. And it's also important to be aware that even like the dried leaves from certain plants can be toxic as well. So just being aware of the plants in your household are really important. Of course, the food items, there's human food items that are toxic to our dogs and cats. Avocado is a no-go. Chocolate's a no-go. Coffee and alcohol can be poisonous. Certain nuts are actually poisonous to our dogs and cats. So familiarize yourself with the different food items that can be toxic as well. Grapes can be toxic in too much of an amount for our dogs and cats. So a lot of little things that we wouldn't necessarily think of can cause a problem for our pets. And like anything, it depends on how much and how often they've eaten it. I know a Rottweiler that has gotten into a box of a dozen chocolate donuts, eaten every single one and been completely fine. Just had a little bit of diarrhea the next day. And then I've known smaller dogs like Chihuahuas to get into a little piece of dark chocolate that they found left over from Halloween and have a severe reaction to it. So it just kind of depends on your animal, the amount ingested, and if it's dark chocolate or milk chocolate and that sort of thing. So again, here's the Poison Control Center's phone number again. They will ask you this information. So have this information available in the event of a poisoning emergency. The exact name of the poison, if it's known. So, if they were to get into a cleaner or something like that, have the cleaner handy. They may ask you the name of it, the concentration of it, that sort of thing. They're going to ask you how much the animal ingested or was exposed to, and then how long ago the exposure happened. They may even ask you the animal's vital signs. So again, knowing what's normal for your pet is really important. Knowing how to get those breathing rates, those pulse rates, and not everybody has a temperature ready to go, but those two are always pretty important. And then the approximate weight of the animal as well. And then snake bites can also happen here in Colorado and around the country. Most common snakes that we have here in Colorado are rattlesnakes. We get the prairie rattlesnake here. In eastern parts of the country, since I don't know where all of our participants are from today, we can get copperheads, cottonmouths, and coral snakes. Dogs are generally bit in the face because they're going to investigate things with their nose. Boom, that's usually where it happens. Sometimes they'll also get bit on a foot or a leg as well, but it's usually in the face, which is extra dangerous. If possible, try and identify the type of snake that bit your pet, and then just get to a veterinary clinic immediately. Most dogs and cats can survive a snake bite. It's pretty incredible. They do go through some respiratory distress. They do go through a lot of pain, but they can recover. So be prepared to kind of assess those ABCs and perform CPR if needed, but most pets don't need that. Also check for signs of shock. Is the dog acting normal? Is the dog cold to the touch? Keep the pets as calm and still as possible. The more excited they get, the more that venom is going to go through their body quickly. So keeping them calm, you staying calm, just getting them into the car, going calmly to the veterinarian, and then getting them situated, then you can freak out and panic. But everything should be calm and laid back until you get that pet that care. Never, ever, ever cut open a wound. These are all old wives' tales. You can't get rid of the venom that way. Never suck venom from a wound. What do you think happens if you get any of that venom on your lips? You then get the venom as well. I have heard stories of generally men that bring their dogs into the vet clinic that have got bit by a snake. And he's like, yeah, I sucked out some of the venom, but now my lips are really numb. And we're just like, oh my God, go to the emergency hospital yourself. We'll take care of the dog. Now you're in trouble. So that goes back to making sure you also don't become a victim, right? Never use a tourniquet because we don't always have the knowledge of knowing what type of venom a snake has. There's different types of venom that cause, that have like anticoagulation properties, so that the animal will just bleed out. There's others that work on more of a neurological level. There's some that cause tissue necrosis or tissue death. So we don't want to use that tourniquet because we don't necessarily want to localize that toxin into one area of the animal. And then never apply ice for the same reason, because we don't want to cause a faster cell death depending on the venom that was used. And then I think this is our last slide. One of the last most common emergencies that we get are urinary blockages in cats. A urinary blockage is absolutely a life-threatening medical emergency. It can happen in dogs and cats, but it primarily happens in cats. And it usually affects male cats more so than it does female cats. Symptoms are usually straining to urinate, straining in the litter box. You may see a little bit of blood in the urine, or they may seem painful in the abdominal area. Oftentimes they will try urinating outside of the litter box, or they'll cry and yowl while in the litter box. This oftentimes happens because of urethral disease, bladder inflammation or bladder infections, or bladder crystals or bladder stones. So what happens as those stones and crystals are forming, it's like little grains of sand that can get stuck in the urinary ducts, so to speak, or the urethras. And it can be incredibly painful. It basically is a stopper and nothing can be expressed, so that bladder continues to fill up. And the animal can get very toxic, they can get very painful, and that bladder can even rupture in some cases. So it's absolutely a life-threatening emergency. If you suspect your pet has a urinary blockage, take the vet to a veterinarian as soon as possible. So just to wrap up, I know that was a lot of information, but believe it or not, you will retain some of that in there. And remember, this is just the foundation for your knowledge base. There are so many other resources that you guys have access to, and your next best stop on your knowledge journey for prevention and information and pet first aid should be your veterinarian. So reach out to them, see what pet first aid resources they have. You can also look into your community as well to see what resources are out there. But hopefully you've learned a little bit more today about how to be prepared. Getting together that pet first aid kit, that emergency preparedness kit, just being informed on what to do in the event of an emergency, having the redcross.org's website, just give that a little look through, or ready.gov is nice to have on hand, but also knowing what's normal with your pet. That is the first line of defense. It's that baseline information that we can then use. And I've used it a number of times. Just knowing, for example, that Misha's normal pulse rate her entire life is 60 beats per minute. There have been times where I've been like, oh my God, why is it 50? Or, oh my God, why is it 80? And you can kind of use that to figure out if you're dealing with an emergency or not. Or if this is just a normal part of what your dog or cat is dealing with. Hopefully you've also learned a little bit about how to protect yourself. We're not gonna rush into an emergency situation and go crazy. We're gonna assess the situation. We're going to be cautious. We're going to try and stay calm so that we don't also become a victim and need to be rescued. You've learned a little bit about how to protect your pet, how to provide care, and how to identify those potential emergencies that may happen. So obviously there's a bazillion things that can happen to our dogs and cats. This is just the most common things that can happen. And now hopefully you guys are a little more prepared. So please let me know if you have any extra questions.
This is great, Emily. Thank you so much for all of this knowledge. I've taken notes. We are recording this so you can rewatch it soon. But yeah, let's open it up for questions. You're welcome to take yourself off mute and ask Emily anything.
Again, Emily, can you stop sharing your screen so we can see your lovely face as you answer questions?
There you go.
What are some of the signs of spider bites versus snake bites?
Great question. So they can be very similar. So the most common insect or arachnid bites that we see are house spiders and black widows, those hobo spiders, but also bees and wasps. We also see a lot in dogs and cats. And they can look very similar. But the differences between snake bites, rattlesnake venom, oftentimes because they're injecting it into the skin, and there's usually a larger amount than a spider or a bee, for example. And so we see a significant amount of swelling in dogs and cats that have been bit by a snake. So that's probably the most obvious difference. With spider bites and bee stings can cause some swelling as well, especially if the dog or cat experiences like an anaphylactic reaction, which is very, very common with bees and wasps. But spider bites can sometimes look completely different. And so you might just have a big kind of pink swelling like on the nose or on the face. With spiders, it can then get bubbly, it can open up and ooze. It can, again, depending on the spider, you can have some tissue die off or some necrotic tissue that happens. Sometimes they have to go see the vet and kind of get that cleaned out and cleared out. And then as the wound starts to heal, you can actually see the two punctures from the spider. I think when you're a vet tech, your pets are generally more accident prone to things. So when Burley, my Akita, was younger, he got bit by a black widow, and we didn't know it at first, but his nose like swelled up. So he has a black nose generally, and all of a sudden his nose became bright pink and like 3 times the size. And we were like, he must have got bit by something. But he was acting totally normal. We were in touch with our veterinarian, and they're like, well, just watch it. It might have been a bug, or it might have been a bee or whatever. But over the coming days, it got bigger and bigger and bigger. And then it started to deflate. And then we started to see like some tissue necrosis. So he actually had to go in and get things kind of cleaned out and cleared out. And thank goodness it wasn't very severe. It just looked really bad for like a month. But most bites, snake bite or wasp or bee, usually it's just, kind of a couple weeks of swelling, and then that goes down and the dogs and cats start feeling better. So, but if they have an anaphylactic reaction, it can be pretty dangerous.
You have some troublemakers over there.
I do. What happens when you're in this field?
Thank you.
Of course.
Thanks for the question. Anyone else have any other questions?
I have one.
Perfect.
I had a dog. Oh, I have one now too that's the same way, but a previous dog that she was totally like obsessed with tennis balls. And I had her at she's from a rescue, and we have this reunion picnic every year at Boulder Reservoir. And so she was there, and people were throwing tennis balls into the water for her, and she was continuously chasing them for probably 3 or 4 hours.
I know where this is going to go, but keep going.
And then I wasn't really paying that much attention, and these 2 little boys brought her over to me, and they said she keeps falling over. And so at that point she seemed okay, and I just kept her from, I thought, well, she's tired, you know, she's been doing this for whatever. I later on kind of put I think it was like even the next day or something, I happened upon this article about water toxicity and how they can, when they're getting those balls in the water, they're taking in a lot of water when they're catching the ball. And I think that's actually what happened to her, because she was like falling over, and the things that they were talking about in this article, it sounded like she was okay, but it can be really deadly. And so I guess what my question is, what are the signs of that? And if you think that they have it, what should you do? I mean, I didn't do anything because I was just like, oh, she's just tired, whatever, you know, and I just made her stop. But I know it can be a lot worse. So if you suspect that that's what's going on, because I have another dog right now that's exactly the same way, that he will go forever. And it was kind of scary. I mean, she was literally just like falling over. She couldn't stand up, and I was like, oh, she's tired, because I was dumb. What are the best ways to recognize that, and what should I have done when I saw that happen?
Great question. I was wrong. What I thought you were going to ask about is something called swimmer's tail, or happy tail. And oftentimes these dogs that will swim constantly, you know, they use their tail as a rudder. And so basically they pull muscles in their tail, and then they can't use their tail. They can't use their back end sometimes.
Wow.
It can be really, really painful, but usually goes away. It's just a pulled muscle. But what you're describing is algae toxicity, which as our temperatures rise in our communities and in our world, this is going to be more and more common. I would venture to guess that your dog did not experience this algae toxicity, because 99.9% of the time it is fatal.
Okay.
So the best thing to do is prevention, right? Usually these algae blooms happen in the mid to late summer, when it's really, really, really hot and the water has just kind of been sitting. And so it's stagnant water, that sort of thing. And we have this kind of green algae look appearance to the lakes. But sometimes you can't always see it. So you can't visually be like, this body of water is safe. And so prevention is key, you know, doing some research online, seeing if there's been any algae blooms in the lakes or reservoirs you frequent, to kind of stay there, or go higher up into the high country where it's a little colder, you know, and kind of swim in those lakes, or a lake that has more movement because there's rivers tied to it and water's moving through it. So prevention is the best thing to do. But if you suspect any kind of toxicity, especially an algae toxicity, you have to get to your vet immediately, because like I said, 99.9% of the time it is fatal. And I don't know, because I have never personally seen a case of algae toxicity, what they would even do for it. I know with most toxicities, you can give activated charcoal, you give fluids, and it's a lot of supportive care to help get the dog's body through that trauma of the toxin. But there's not necessarily like an antidote that you can give them to kind of bounce them out of it. Kind of same with in the late spring, early summer, we also get mushrooms in our backyard and in our grass. And if dogs ingest those, that can also be incredibly toxic and dangerous and lethal. But it's the same kind of thing. There's no antidote we can give them. Sometimes in the case of mushrooms, you can have them vomit, but then again, it's just that activated charcoal, IV fluids, supporting their body, and hoping we can get them through it. So yeah, prevention is key. Did your dog vomit or anything like that that day?
No, I mean, I really thought it was just that she consumed too much water while she was catching those balls. Because like I said, I read the article like the next day or something. It was an article about the dogs that do that they can actually get too much water, and like they literally, like it you know, causes their electrolytes and everything to go haywire because they have too much water in their system.
Possible. Yeah, I mean, humans can get that too. You can have too much of a good thing.
Right.
And drink too much water, yeah, it gets the electrolytes out of balance. So a little different than like a toxin per se that she would have ingested.
Mhm.
So it could have been a combination of things, just electrolytes out of whack, as well as true exhaustion. I mean, dogs can exhaust themselves too.
Mhm.
Just kind of, and that also presents in kind of that wobbly, staggering, I can't stand up kind of a appearance as well. So hard
Okay.
to say what happened without being there.
Right.
But I always err on the side of caution. I live by the better safe than sorry. So in the future, if something else were to happen like that, just calling your veterinarian and just saying, hey, do I need to be concerned? Do you want to see my dog? Should I bring her in?
Mhm.
What should I do is the best thing to do.
Okay.
Worst case, you spend a few $100 that you didn't need to spend, but at least your dog, is okay. So
Right.
that's kind of how I live my life. But I was a tech and I know all like the horrible, terrible, absolute worst things that can happen to your animals. So like if my dog like farts wrong, I'm like at the vet, like, oh my God, is everything okay? So that's just me though.
No, I'm like that too. Luckily, I have a vet who understands that that's how I am, and
Same.
he's okay with it.
I am the same way as well. My dog bit off a piece of the indestructible toy, and it's not indestructible. And I took her, and they're like, well, how big was it? We showed them the toy. It was probably the size of my nail. And they're like, she's going to be fine. It'll come out the other side. But I would much rather check than not. And they did not charge me for that.
Oh,
Thank you. It was the middle of the night. Of course it was. So always worth checking out. So thank you for the question, Colleen. Thank you for answering, Emily. I put a link in the chat box, and that's to our short survey. If you could just complete that at some point during your day to let us know what else you would like to learn about, how you enjoyed this workshop. It really helps us to continue giving you what you need and want. So thank you for doing that. And we have 2 more minutes. If anyone else has any more questions, feel free to ask. Don't be shy. There's no dumb questions.
no dumb questions.
Our former dog had seizures, and we were advised by the vet to put like a frozen bag of peas between her shoulder blades to keep her cool as well. Have you heard of anything like that, or does that hurt in any way or help in any way that you know of?
Yeah, I haven't heard that personally, but I can't imagine how it would hurt anything. I bet you the idea is just keeping her body cool or more at a consistent temperature. If she's not able to pant and release heat, that might have just been their way of thinking. This is something simple and easy to keep them cool and calm. So
Yeah, it seemed to help a little bit because she would get feverish afterwards. Mm-hmm.
there you go. Yeah.
Okay, good to know we didn't do anything wrong.
No.
Thank you.
All right, last call for any other questions.
Question, and I don't have a dog or a cat, so this is just like out of curiosity. When you, like Colleen was saying, maybe you're going into a situation where something may happen, where they are you taking them on a hike and overexerting, are there like electrolytes or things you can pump in them prior to going to like help with immunities, or if they get, they eat poison ivy or et cetera, et cetera?
Right. The answer is yes. There are like electrolyte type things you can give your dogs or cats. But generally, like getting them to take it is a whole other situation. And most of us aren't going to be giving our dogs, IV fluids or sub-Q fluids or things like that. And the things that are ingestible, they won't always, drink right before a hike. So, and I'm not a huge fan personally of adding an additive to a dog or cat's water or a bird for that matter, just because the last thing we want them to do is have like a negative association with water and not drink at all. So the best thing you can do is just kind of feed and drink them normally, just make sure they have access to fresh water before a hike. Make sure you've given them a good meal that morning before the hike, maybe not too soon. maybe not within like 30 minutes to an hour of the hike, but like, a couple hours beforehand. Giving snacks during the hike is always a good thing to do as well. And if the worst case scenario were to happen, where they were to ingest something on a hike that is toxic, or is going to cause a problem, or they start vomiting, if you have access to a phone and you can call your veterinarian and ask, that's the best of the best. Otherwise, just staying calm, getting down off of your hike, or getting back to the vehicle and then just getting to them to the vet is the best thing. Most of us don't carry like hydrogen peroxide with us, or other things that can induce vomiting when we're hiking. So really in those situations, you just kind of have to stay calm, stay focused, and then just get them to a vet. Yeah, and like I said, I'm a big proponent of prevention as well, and preparing yourself. So here in Colorado, there are certain types of plants like along the hike that we have to look out for. One of them is, I'm not going to remember it now. It's a type of hemlock that is like highly poisonous to dogs and cats. It's this beautiful white flower that grows along the rivers here in Colorado. And I have seen my dogs try and eat it. And I'm like, for the love of, whatever, do not eat that. And so you just kind of have to prepare yourself, familiarize yourself with the things that are toxic that you might encounter, and then just be vigilant. So that's the best you can do.
Okay, thanks. Amazing presentation, by the way.
Oh, good. I'm glad. I hope you guys liked it.
It was great.
It was great. It was really good.
Yes.
Oh, kitty.
That's actually my text messaging.
Oh, right on cue. So awesome. Well, thank you guys for joining us today.
Thank you, Emily, for sharing this knowledge with us. We appreciate you and your time. So thank you all for coming. If you please fill out that survey, like I said, and we will make sure that this recording will get up on our YouTube channel shortly. But feel free to reach out if we can provide any other resources for you. We're always happy to do that. And we agree with Emily that prevention is the way to go. So plan and prepare, and then enjoy your pet. Thank you all very much and have a great day.
Take care, guys.
Bye.
Bye.